other big thing I want to talk about is the Extra Help program from Social Security. This is a program from Social Security to help people pay for their Medicare Part D drug costs. This is for people that are low income, low assets. This is a fantastic program. All right. We have so many people that say, I got these expensive drugs, I can't afford to pay for them. Well, if their income, these are the 2020 numbers, the 2021s are not out. They won't be out to the end of the year. But as of 2020, if they make less than $1,593, or that's $19,140 annually, they can get help with their Part D drugs. All those Part D plans that I said were out there, there's a bunch of them that work with this Extra Help plan. You can get coverage up to plans that have 0 premiums, 0 deductibles, and the most a single drug will cost you in 2021 is $9.20. I don't care if that drug costs you normally $6,000. And they're out there, believe me, they're $6,000 drugs. If you become eligible and apply for this program, Extra Help program through Social Security, you will not have a drug that costs you more than $9.20. Generics, no more than $3.70. You can apply for this program right on the Social Security website. It's real easy. Go to ssa.gov, click on the online services, click on Extra Help. It'll take you less than 10 minutes to fill it out, and they don't require verifications. You usually get notice of approval or denial within 2 weeks. So if anybody has income that's even close to that, I encourage you to apply. Now, our Part D costs. This is just a chart showing the comparisons. Like I said, we did get the Part D numbers. They always come out earlier because open enrollment starts on October 15th. In 2020, the maximum deductible was $435. This year, the maximum deductible is $445. The initial coverage limit, going to donut hole, like I said, it doesn't really apply to most people, but it went up a little bit. Out-of-pocket threshold applies to the donut hole, doesn't really apply, but went up a little bit. The maximum cost with Extra Help, last year was $360 for a generic. This year it's $3.70. Brand name $895. 2021, the most you're going to pay is $9.20. Okay, so there was a little bit of increase from 2020 to 2021 on Part D drugs. At the end, I've got a slide that shows the Part D plans. I don't know if Tammy's going to post them. I sent it to her as well. But basically, I would strongly encourage you, if you're computer savvy or you've got, nieces, nephews, grandsons, granddaughters, whatever, they're computer savvy, go onto Medicare.gov and click on their plan finder. It is now showing a preview of all the 2021 plans. You can't sign up yet, but it's showing a preview of the 2021 plans. If you aren't savvy enough to go in and do that, and it's okay if you're not, you can call up our senior helpline. I'll give you the number at the end and set up an appointment with our SHIP sites. This year, open enrollment's going to be a little bit bumpier, guys, because of COVID. We'll talk about that in a little bit. Some of our sites aren't open at all. Some of them are only doing Zoom appointments. So it's going to be, a little hit and miss. So if you need an appointment, I would call sooner than later. Excuse me. All right. Everything I talked to you about so far was original Medicare. A and B and D. And then you may purchase a Medicare supplement, or you may have a secondary plan. You may have a retiree plan or something else that goes along with that, either one. So you can have those choices. The other choice that's available to everybody is called a Medicare Advantage. It's also referred to as Part C. What it is, it's all that same coverage under original Medicare, but it's wrapped up into a managed care plan. And all that same coverage. So everything goes under a managed care plan and everything is through them. They have to give you the same coverage. As a matter of fact, they're allowed by law to give you extra things. Under original Medicare, it does not cover routine, vision, dental, hearing, podiatry. All right. Illness and emergency, yes. These plans can offer other supplemental benefits, fitness clubs, things like that. All right. So people ask, well, why would somebody want to sign up for these? Well, they may want to sign up for these extra benefits, plus the costs may be different. All right. So basically, it's the same coverage. It's just delivered differently through a managed care plan. And as you'll see, the cost structure will be different. So if you sign up for one of these plans, you're going to get a card from them. The example on the screen, we're not endorsing this, it's just one we pulled off the internet, Meridian Care. That is the card you would show to your doctor, and all your coverage would go through them, as opposed to original Medicare. What would your costs be? They probably wouldn't be the same as on those A and B charts like I showed you. Each plan has their own different cost structure. So that's another reason why some people may take these plans. They may be able to get one of these plans cheaper. And like I said, they may offer more benefits. Some examples, you may have HMOs, PPOs, private fee-for-service, special needs. HMO, it's the most restrictive. You gotta stay in network. You gotta have referrals. But it's generally your lowest cost option. You may be able to get an HMO that's a lot cheaper than original Medicare. Now, first question I'd be asking you is, do you travel? Well, yeah, I go down to Florida and I went. HMOs may not be a good option because you're gonna be out of network. So it all depends on the individual circumstance. There'll be PPOs out there to look at. A lot more flexibility. You can go in network at the lowest price, copays, but you still have the option of going out of network anywhere in the United States. You just pay a higher copay. All right. So it's higher cost, but it gives you more flexibility. There are things called private fee-for-service. I looked at the plans. There's only one in the state of Illinois for 2021. These are kind of going away. It's basically what it comes down to is they offer their plan. You take that plan, you go out and shop for your doctors to see if they'll accept it. So it's the most flexibility out there as far as coverage, but you got to build your own network of doctors. Like I said, there's only one in Illinois in 2021. And the costs are usually a little higher than HMO or PPO. And just so you know, there are what they call special needs plans out there. There's plans that are meant specifically for certain illnesses and diseases, or plans that are specific for people that are in nursing homes. Now, these plans aren't everywhere in the state, but you can check and look for them on the plan finder or have a counselor help you check. These special needs plans are built around you. Example, one of the most popular ones I see is heart and diabetes. So somebody who has either one of those conditions, they may have a plan available to them, and that whole plan and doctors and drug system are all set up around your medical condition. So it's an option. Just like I said with Part D, your Part C is about options. So when you look for a Part C plan, yes?
Dave, we have a question. I'm sorry. Is it still true that if you don't sign up for a drug plan during initial enrollment period, that you pay a penalty for each year you do not take the drug plan?
Half true. You do pay a penalty if you don't have other coverage. If you have other credible coverage from somewhere else, you're good to go, no penalty. But if you do not have credible coverage for a Part D, it's not for every year. For Part D, it's a penalty for every month that you don't sign up. All right. So if you do not have credible coverage from somewhere else and you do not sign up till later, you will have a 1% penalty for every month that you don't sign up. It'll be 1% of whatever your monthly premium is. And your Part D plan would calculate that out for you. So yes, penalties if you do not sign up on time. But like I said, D is more flexible. If you've got other coverage, you're good to go. If you don't, yes, penalty, and you may have to wait. Great question. All right, I want to kind of show you just a little bit of comparison. If you'll remember back when we first started, I showed you these charts and had all these different costs of what Medicare cost under A and B. Those are set. If you have no other insurance, no secondary med subs, those are what you pay. Medicare supplement plans offer their own cost structure. This is just an example of one. Under original Medicare, we said you normally paid 20%. This plan that we pulled up as an example, primary care, this must be a PPO because it lists in-network and not a network. My in-network copay at a doctor, I pay $0. If I go out of network, it's 25 bucks. Specialist, 35 bucks in network, 50 out. All right. Inpatient coverage. We said under original Medicare, the first thing you pay right off the bat is $1,408 deductible right off the bat. Then you're covered 20 days and then you start incurring more costs. This plan's different. This is $300 a day for days 1 through 7, $0 per day after. Some of these may be better than original Medicare. Some may be a little bit higher. It's all about shopping. Okay. Same thing with the skilled nursing. In network, 0, 1 through 20, 184. So it's all about comparison shopping and what's best for you.